Over the last quarter, we've worked with our startups, seen each of them grow, been really excited to share their positive news stories, and moving forward really thinking about what we could do to not only help the startups in this cohort, but finding those exceptional startups in the ecosystem for 2.0 and seeing how we can help them for the future as well.
There's a number of programmes, commitments that have been made by our national organisations, NHS England, Department of Health, to really drive a programme of digital innovation over the next few years. And startups are going to be fundamental to that journey.
I'm Nick from Pazziz. We're excited to be here with Velocity Health in Manchester, exhibiting on the MSD stand. We've had a great first day, and the response has been great. Lots of interesting people, lots of interesting conversations.
So starting in February, we did our first rollout, our first study, which was in India, followed very quickly by one at Great Ormond Street Hospital. And following that, we've had several more studies go in. So there's one at Manchester Children's Hospital just up the road, and we're very lucky to have been given the opportunity to do a study at the National Institute of Health in the United States.
We've had an amazing few months. We're currently raising our seed round, so we've got to that stage, which is great, and that's going to help us and enable us to continue on for the next 18 months and sort of execute on the business plan that we have, that we're working on. We have a new developer coming on board, which is really exciting, and especially for my co-founder, technologist Greg, he'll be delighted to have another pair of helping hands.
Really excited about tonight. We're launching Velocity Health 2.0. Our second year in partnership with Wayra. Our focus this year is going to be oncology and diabetes, yet another chapter in the 5-year forward view.
I suppose the model of old from our perspective was, let's go out and develop an app to try and support our core business. I think what we've learned over time is that we're actually not very good at doing that within the existing governance structures that we have in a corporation like MSD, and so partnering up with Wayra through Velocity Health has really changed the way in which we've thought about technology moving forward, really.
We have some fantastic technology that we bring through development and to the NHS, and we navigate the system for our products. But what we realise is that as we go forward, that's no longer good enough. We have to be able to work in partnership with the system to demonstrate the value of our products right the way through the pathway. In order to do that, we have to realise digital technologies to be able to create efficiency in the system, so the system can afford to create great care for all patients in the future.